Priority setting in global health. In global health, priority setting is a term used for the process and strategy of deciding which health interventions to carry out. Priority setting can be conducted at the disease level, i.e., deciding which disease to alleviate, the overall strategy level, i.e., selective primary healthcare versus more general health systems strengthening, research level, i.e., which health research to carry out, or other levels. 5. Definitions. Priority setting is the act of deciding which health interventions to carry out and can occur at several levels of granularity. Priority setting can occur at the following levels. 5. Health budget level, i.e., deciding how much to spend on health overall. Overall strategy level, i.e., selective primary healthcare versus more general health systems strengthening. Disease level, i.e., deciding which disease to alleviate. Intervention level within each disease, i.e., restricting to a specific disease and prioritizing among interventions for that disease. Drug level. Research level, i.e., which health research to carry out. Synonymous terms include prioritization in healthcare and health research, priority determination, health priorities, and agenda setting. Metrics. Various metrics have been used to compare interventions. These include disability-adjusted life year, per unit cost used by, e.g., disease control priorities project, quality-adjusted life year, and other forms of cost-effectiveness analysis. Reasons that the disease burden has persisted. Adequacy of funding. Who sets the priorities? Priority setting can be done by various actors. These include governments in most countries. Health spending by governments vastly outpaces international health aid, so governments set most health priorities. Nonprofits and companies that assist governments. If a country is using a health in all policy high AP approach, then priority setting is done by stakeholders who do not directly deal with health. International organizations, foundations, private donors including high net worth individuals and ultra high net worth individuals. A common outcome is a negotiated set of priorities that reflect some domestic needs and some technical, political, and economic considerations defined largely by the interests of donors. In some highly aid-dependent countries, donors have huge influence on health priorities. According to Divi Sridhar, professor of global health at the University of Edinburgh, the priorities of funding bodies largely dictate what health issues and diseases are studied. History of organizations and programs working on priority setting. According to Amanda Glassman et al., global level priority setting has occurred since at least the 1980s, though these efforts have only focused on a few aspects. The following table is a timeline of organizations and programs working on priority setting. Reception. The result of a myriad of actors championing a kaleidoscope of priorities is confusion. Advocates, researchers, and policy makers have labeled almost every disease, condition, medication, or intervention a health priority. Rudin et al. Says that priority setting efforts have relied on consensus reached by panels of experts and as a result have not been systematic enough, and that this has often made it difficult to present the identified priorities to wider audiences as legitimate and fair. Glassman et al. Notes that criticisms of priority setting include the weak data on which estimates of burden, cost, and effectiveness relied, the value judgments implicit in disability-adjusted life year age weighting and discounting decisions, and treatment of equity issues, as well as the political difficulties associated with translating a ground zero. 16. Glassman et al. Also notes how there are more cost-effectiveness studies for LMICs in the thousands, but that these are unlikely to be actually applied to priority setting processes. 16. Jeremy Schiffman has said that some bodies such as the Institute for Health Metrics and Evaluation and the Lancet are prominent in priority setting due to their dominion rather than data and analysis, and also notes that the process of creating the Sustainable Development Goals was not sufficiently transparent.